See. Okay, we are live. So let me go over here and do that. Because that's when we'll hear it coming in twice. There it is. It's taking longer than usual.
Of course.
This always happens, I swear. How did I go back? Okay. So I know there's people that I've been talking to that are going to be in a chat room. So
Okay.
let's see if we're good on this end. There we go. I'm muted, and I think we're great. Ready to go. All right, perfect.
Okay.
Chat's up, everything's ready to go, and we're ready to rock. All right.
Okay.
Good evening, everyone. I'm Chris Wilson with UpstreamVitality.com, and I have with me an awesome guest. I'm so thrilled and excited that she's accepted to come on here and do an interview where we're going to talk about the danger of silver fillings, hidden infections, and how they might be suppressing your immune system or with no symptoms, really. And you're wondering why you may be feeling the way you do, and it all could be contributed to your oral health. So we're going to get into that, and I think it's going to be an awesome, fun time here. And before we jump in, I just want to read a brief introduction about my guest. Her name is Dr. Lane Freeman, and she completed her undergraduate work at the University of Texas in Austin, receiving her Doctor of Dental Surgery degree from the UT Health Science Center's top-rated dental school in San Antonio. Dr. Freeman has completed numerous hours of continuing education in the fields of biological dentistry and is also certified in IV conscious sedation. She is an accredited member of the IAOMT, the International Academy of Oral Medicine and Toxicology, member of the American Institute of Implant Dentistry, the American Dental Association, and the Heart of Texas Dental Association. Dr. Freeman has a passion for educating her patients on the relationship between their oral health and overall systemic health. In addition to her practice in Marble Falls, Dr. Freeman enjoys participating in mission experiences, both locally and abroad. Her vision and that of the entire staff is to exceed each patient's expectations every time. And I know for a fact, your office has definitely exceeded my wife and mine's expectations for sure. So thank you so much for coming on, and it's great to have you here.
Well, thank you so much for having me.
Yeah, it's awesome. It's a pleasure. So from what I understand, if I'm correct, you were actually a patient of Dr. Nunnally's as a child growing up before really working in his clinic. Is that right?
That's correct. He and my dad are great friends, and I've known him since I was about 5 years old and was his patient all growing up. And then in high school, I needed a job. I wasn't particularly interested in dentistry, but he gave me a job just in his front office. But just being around him and then learning from him just basic general dentistry, I really developed an interest in it. At that point, our clinic would not be considered a biological practice. We did not place mercury fillings, but it wasn't really necessarily for a big biological statement. It was just more because we were a big cosmetic practice that Dr. Nunley had, and he was very health conscious. And so we just had a lot of patients that at that point just wanted things to look nice. But after I graduated from high school and then went into my undergraduate degree and really knew I wanted to pursue dentistry as a career, then got into dental school right before I came back, literally, really, probably in the weeks leading up to me receiving my dental license. He became very ill with what they thought was for sure ALS or Lou Gehrig's disease. And ended up being diagnosed as severe mercury toxicity. Literally at that point, probably one of the highest levels of mercury toxicity that the lab that did the testing had ever seen. He was cleared of the diagnosis of ALS, but that's how significant his symptoms were at that point. So literally the day I got my dental license and walked into the office to work here was the day he left and went on a journey to recover his health to detoxify, and then that caused us to completely change the way that we looked at dentistry. I was blessed to come into that right out of dental school, and begin to practice that way almost literally from the very beginning. And then we've just really, with Dr. Nunley's leadership and just all of the research that's out there and that continues to come out, have then just changed the course of our practice to really serve patients from a standpoint of everything we put in your mouth and everything that's already in your mouth can affect your overall health, just like your overall health can affect your mouth. So brief history there.
No, that's great. And what I love about that is you already kind of had a head start into the holistic approach of general health, just outside of your conventional dentistry, which is a really good head start. And I know more people are kind of coming into the knowledge of, I guess, doing their own research for becoming an advocate of their own health in terms of wanting to get well, because they're kind of tired of going to not one, not two, but sometimes 7, 8, and 9 different doctors to find solutions that they're just not finding. And it's, hey, you got this symptom, let's band-aid that with this medication, and then let's give you more medications because you're getting new symptoms because of that medication. So, and it's just this vicious cycle that never ends. And I think people are finally getting fed up with our, I call it the sick care system versus the healthcare system of today, but that's just kind of where we're at, and it's a bummer. You definitely touched my wife and me, our lives specifically. What put us on this pursuit was a book that I had picked up in Natural Grocers called Paleocardiologist by doctors Jack and Heather Wolfson. And in there is where I found out about, I think his chapter was titled A Healthy Smile, or Your Teeth or Your Toxic Teeth, something of that nature. Mm-hmm. And he detailed, fillings and root canals and other issues that could affect a person's overall health by the health of their mouth. And he had put on there the IAOMT website link. And so we went onto the computer. I think we read that book in like the same night I bought it. It was just so much information. We're like, no way. And we had found all of these biological dentists that practiced, holistic dentistry. And so the IAOMT, explain a little bit about how you got involved with them and how that's crucial for people to get their silver fillings removed, or why that's even necessary or an important process to do correctly.
Okay. So let me just make one comment on something you said briefly, just at the beginning of that. And in that, that's probably a story I hear multiple times in a week in talking to patients, as far as that they have been to multiple doctors. They have these really hard to put a finger on symptoms, but they know something is off, or they've had these symptoms that are very clear cut, but nobody can find a reason. And they've been through multiple conventional doctors, many of which are very well-meaning, but that just can't really find a cause. And so they do Band-Aid it with a lot of medications, which, as we know, can then cause a lot of side effects. And so I do hear that every day. And many times it's just heartbreaking, but it does lead people to do a lot of their own research or to seek non-conventional therapies, which then lead them a lot of times into looking at their mouth and how that can affect your overall health, how everything in our bodies are connected. And so as far as the IAOMT is concerned, they are just a fantastic organization that has really brought a ton of research in the medical and dental communities together so that we can start to put all the points together of, hey, we know that this doesn't work in the dental community, and we know that this doesn't work in the medical community, and bringing those things to light. Hal Huggins was definitely really considered the father of kind of anti-mercury and mercury awareness in dentistry, and also in reminding everyone about Weston Price and his research on root canals. So if you put all that together, the IOMT really brings all that together. They are a very well-respected organization with many dentists, many doctors, many researchers. They have access to so much information, and they really bring it together. They're very science and research-based, which is very important to us, because as much as we love a good story on something that worked for somebody, we also want to see the science behind it. And they also help encourage more science as far as the overall connection between the oral and systemic health. And so that's where that comes from. Now, as far as mercury filling. So you mentioned even earlier that the danger of silver fillings. So part of that myth right there is that they are silver fillings. Really, any silver filling you have in your mouth, that kind of sounds like you're wearing jewelry in your mouth. It's not really true. The fact is that any of those fillings that are silver in there are actually 50% minimum of mercury. You know, like on an ingredient list, they always list the highest ingredient first. And so in a mercury filling, mercury silver filling, mercury would definitely be listed first because every filling is a minimum of 50% mercury. Many times it's more than that. But then there's all sorts of other metals mixed in with that. You could have some silver, and a lot of times there is some silver, but many times there's also copper or tin or aluminum or nickel. All of these different metals that get conglomerated with that mercury. Now, the problem is when mercury is really liquid at room temperature. And so, of course, to make it a solid filling, you have to mix it with these other metals. But what happens is that the mercury constantly outgasses from that. So it's a metal that's in your mouth. And so just like any other metal, it's going to expand and contract with every cold drink or cold piece of food or hot drink or hot piece of food you put in your mouth. You think about that, the number of times you do that during the day, you're getting some expansion and contraction on a really small level. But there's so many studies that are showing that this mercury is outgassing, coming off of this filling for the life of the filling. If you want to see, I think you had mentioned maybe you had watched this, and you can find it on the IAOMT website, is the smoking tooth. And that's where they took a tooth that had been extracted, and I think it has like a 30-year-old mercury filling in it, and they rub it with an eraser to simulate like if you were chewing against it. And then they put it behind a black screen, and you can just see the outgassing of that mercury. And if you were to measure that, you would be way above the EPA guidelines for the maximum amount of mercury to come off of that. The biggest problem with mercury is that we know there's no one argues that mercury is a toxic substance. I mean, that part is not an argument. The argument that we see is that, oh, well, once you mix it with things and you put it in the mouth, it's no longer toxic. But wait a second, if you go in to take that mercury filling out, if I take that out in pieces, then everything else I use in my office can go in the trash or go down the drain. But those pieces of mercury filling, I have to set those aside, and then they need to go into a biohazard, a hazmat basically jar, and I have to separate that from the rest of my trash. So it doesn't make a whole lot of logic sense that we're saying, hey, it's okay if it's in your mouth, but the second it comes out, that's again a toxic substance. So that's the problem with mercury fillings. Now, one quick aside on that is that although we know mercury is one of the most toxic substances to man, everyone does respond to that differently. Some people genetically are just set up that their body removes heavy metals a lot easier than someone else. So there's definitely certain genes that are programmed to help you remove that. So I may have in my practice, I'm sure I have some 80 and 90-year-old patients that have had mercury fillings their whole life. And to our eye, they have no noticeable medical issues. Their body definitely knows there's mercury there, but it hasn't responded to it in a negative way. And yet on the other end of that, I have stories from so many patients that they were doing great health-wise, and then maybe they had a few mercury fillings placed, or they had a few mercury fillings removed incorrectly, and they received a huge dose of mercury, and it so adversely affected their health that it was just unbelievable, the change that they saw. And so that's the problem. We don't want any more mercury fillings placed, but we definitely want people to be educated on what's in their mouth and how it can be affecting them individually.
Excellent answer. And you brought up a lot of good points. I'd watched an interview with Dr. Pompa and Dr. Thomas Levy, who actually left his practice as a cardiologist to go work with Hal Huggins. And the types of diseases that he saw people having just from their mouth and within the relationship with their heart disease or different symptoms that they expressed, where he thought there was no really correlation to the two. And then the study that Weston Price did, where he had taken root canals, sorry, this is probably going to offend some animal lovers, but out of people and placed them into rabbits,
Yeah.
and the rabbits contracted the exact same bacterial disease as the person, almost identical. And it wasn't just one rabbit, but it was like 100 different rabbits.
Mm-hmm. Mm-hmm.
And you brought up another interesting point too with the DNA, because it's where I get a lot of people and a lot of pushback is, well, I've had my mercury fillings in for, gosh, like you said, 30 years and it's never affected me. But I always liken people to having, we're made up of 70 trillion to 100 trillion different cells. And each one of those cells, in my opinion, has a toxic overload bucket. And when it gets to the tipping point, or kind of like a glass of water, you fill one up halfway full and one pretty close to the top, and you shake it vigorously. Which one is going to spill over first? The one that's more full. And in my wife's case, that's what I think what happened with her was, she had the hidden infections, which we'll get to in a moment, with the infected root canal and the cavitations. And not only that, the mercury fillings. And then we lived in a home that was exposed to black mold, Stachybotrys more specifically. And so, I mean, you have kind of the perfect storm that builds up, and it just, it's like a three-legged stool. You take one leg away and it falls over, and all of a sudden your body's in chaos. Your immune system is just suppressed. It can't function. And we're wondering why we see so much hormone dysregulation within people, because I know that the elemental mercury form that you mentioned in the fillings, I believe it turns inorganic from the vapor and gets locked into the deep tissue, specifically the brain, and it binds on the hormone receptors and the HPA axis, which is the control tower of your endocrine system.
Yeah.
And I mean, we have so many bizarre, unexplainable symptoms from people today, and it's just nobody's looking at the mouth.
Yes, absolutely. Mercury really has an affinity, like you said. It can definitely cross the blood-brain barrier, just like you mentioned. Has an affinity for that nerve tissue and for muscle tissue. It also loves to bind up on a red blood cell, the oxygen carrying capability. So that's when we get concerned that it could be a contributor to chronic fatigue. There's so many things, like you said, that it can contribute to. We're always really careful to tell patients that our bodies undergo so many stresses and things that can traumatize the body. And the way we're made, the way God made us is really unbelievable, that we are able to respond to so many insults. But like you said, that is the perfect example. It's like filling a water cup too full. You take on so much, or it's just the tipping point. And what's the last insult that just kind of tips you over the edge? If you have these other types of insults in your system, whether that be root canals or mercury fillings, or whether you've had some major stress in your life, but you have these other things on top of that, the way you've described it is perfect. So
it's almost as if it's the body doesn't know the difference between a chemical stressor, a physical, or an emotional stressor. And when you add up all these combinations, it's just everything goes haywire. And we see like an epidemic today of autoimmune conditions just rising so high, like just exponentially almost. And people are wondering why.
absolutely.
So talking about mercury and removing. So what about, because I have a friend and I'm sure he has cavitations, and I know he's got the silver fillings or mercury fillings.
Mm-hmm.
He was asking me if I can't afford to do them all at once, what would be like the most important, or number one, at least in priority, should I get done first, or can you attack them individually, or how would that process work?
Absolutely. So let's just define cavitations real quick for everybody. So we've mentioned root canals and cavitations. So let's just define those really quickly for everybody. As far as when I'm looking in someone's mouth, let's say the initial time I look at their x-ray and I have them in the chair, I'm looking for everything that a conventional dentist is going to look for. I'm looking for periodontal disease, because that's a very real source of bacteria. I'm looking for cavities and things like that. And I'm looking for really obvious infection, like they're really hurting or something. Then when we move beyond that, we're looking at materials like mercury fillings that can be toxic. We're also looking at nickel crowns that can be toxic for people. And then we're looking for hidden infection. We're looking at root canals, which we can go into a little more detail about these in a minute, but just to touch on that, the reason we call root canals kind of a hidden source of infection, or it's kind of referred to as the hidden epidemic, I think Levy refers to it as that, is that root canals contain so much dead tissue that no matter how well, there's a lot of great, talented endodontists, root canal specialists, and they can really go in there and do their best to clean out the inside of a tooth. But there's miles of these microscopic and not so microscopic tubules. And so when you do a root canal and you cut off the main supply of blood to the tooth and the nerve supply, you get all this dead tissue still remaining in the tooth. And bacteria, what do they love? Not a lot of blood supply and a great host of dead tissue and a nice cozy place to live. So that's basically what a root canal treated tooth is. Then they can just send their toxins out from there. A cavitation would be very similar to that. So a cavitation is anywhere in the bone where you have kind of a cocoon of infection. So cavitations can actually occur anywhere in the long bones of the body, but specifically for our purposes in the jawbone, any place that you have a tooth taken out. When the tooth is taken out, it can be taken out properly, but if the socket isn't cleaned out properly after the fact, then as the body tries to heal that, there's a lot of junk in the way. So maybe the ligament that was there, or if it's a wisdom tooth, it might have been the developmental sac that's around there. And if they don't clean that out, if they don't know to go in and clean that out, then as the body tries to heal that, you kind of get a little hindrance in the way in the middle of the bone there. Everything heals up on the outside, but on the inside, you end up kind of like a root canal tooth where you have dead tissue, you don't have a lot of blood supply, that gets real stagnant, and you kind of set up with this area of necrotic or dead bone in the middle there. So that's when we refer to a cavitation, that's the hidden infection in an old extraction site that we'll see. And if I go into one of those, it's really crunchy or it's really soft and mushy. Those are the things that I feel when we're in there cleaning those out. So back to your friend now that we've defined that. So yes, absolutely. When I look at someone's mouth, I'm going to look at everything that can be affecting them. But then I need to look back individually for each patient at, okay, what are your health issues and what are your health goals? Let's say that your symptoms would make me more concerned about the mercury toxicity, the mercury or heavy metal burden that you've got in your system. Then I'm definitely going to recommend that we get those mercury fillings out first. And I would say the majority of the time, if I'm having to pick between cavitations and mercury fillings, I'm usually going to say your symptoms usually probably match up more with us getting this out first and then addressing the cavitations second. But there are occasionally, I just had a patient like this where I really felt like her symptoms really were more related to an infection that was hidden in the bone. So we're going to address her cavitations and a really infected root canal first, and then tackle the rest of her metals with the thought that her body's going to be able to recover from the mercury removal a lot better once we have the infection out. So everybody's different. It's not just a one size fits all. And definitely we want to help people look at their mouth, even if they don't have specific symptoms. Let's say they're trying to be proactive on their health and they just say, I just don't want this in my mouth anymore. Then we want to help them meet those goals, but based on what their individual needs are.
Okay. And what I'm hearing you say correctly is that a root canal is essentially a dead tooth or dead tissue, or it's a dead tooth that has dead tissue inside. Mm-hmm. And from what I understand, just from anatomy and physiology and within the medical community, no one accepts dead tissue anywhere else in the body as biologically compatible, but yet we leave it. No one ever thinks about this in the mouth. Is that right?
That's correct. You know, as dentists for years, we've been taught, you know, that the best thing is to maintain everybody's teeth, all of them. And I love that thought. I hate it anytime we have to recommend that someone have a tooth removed. However, what we have to think about now that we really are more aware of how everything in the body is connected, we have to think about, okay, we're saving this tooth, but at what cost? At what cost to the immune system? And at what cost to your overall health? Because you're right, I use that example all the time with my patients in that, you know, everywhere else in the body, the medical community says you cannot leave dead tissue. You can't leave a dead appendix. If you get gangrene on your toe, you got to cut it out. Anywhere that we find dead tissue, the medical community automatically, we know that needs to, if you can't revive it, it needs to come out. And so the same should hold true in the mouth, but for some reason, you know, that it's a slow turn of that boat to get everyone back on that page. But when I explain that to patients and I give them that example, it really is like a light switch. They're like, oh yeah, dead tissue doesn't always go. Now, just to be clear, not every single root canal tooth do I take out. It's always the patient's decision. And once again, back to that individual assessment is with some patients, we may say, hey, let's keep an eye on this. Your immune system seems to be functioning pretty well right now, but I always want to watch this. And at some point, we may want to take this out. And always, if somebody comes in and doesn't have a root canal, but let's say we find a dead tooth or they are hurting, I'm going to give them every bit of information I can on what their options are. Here's what a root canal does for you, and here's the risks and benefits of it, which the main benefit is that tooth stays in your mouth right then. And then here's the risks and benefit of a root canal. I would say 95% of my patients, either ones that are very well educated on biological dentistry and also ones who have just come in off the street, or I've known them for 20 years and we haven't ever had a conversation about biological dentistry. Once you start to lay out some of that real basic, just common sense, I would say 95% of my patients choose to have a tooth removed instead of leave that dead tissue in their mouth. So
I think that's what we done on my wife. She was like, what should I do? I was like, get that thing out of there. I don't want any other further complications down the road. So we just might as well extract it now, and we can just, talk about what we're going to do later. So what are some of the, I guess, the more dangerous bacteria that live in cavitations or the root canals? Because they're anaerobic bacteria as far as I know. And can they, so I guess this is a loaded question. What are some of the types? And can they also say like harvest other bacteria like Lyme disease, or are they mobile? Can they move into the gut upon removal, or can they affect other type of areas or organs?
So, that we do have some testing available. And I wish I had thought to ask this before. I'm not sure if we did this with Amanda, but, we have some testing available. We call it DNA analysis. And it's where we take a sample right after we remove the root canal tooth. We either send the actual root of the tooth, or we take a sample from the socket before we clean anything out, or if we're in a cavitation, right when we get into that cavitation, we'll take a sample before we clean anything. And we can send that off, and there's a lab in Colorado called DNA Connections, and they will run a DNA analysis, and then we'll get a report on all the bacteria that were in that site. Now, inevitably, we're going to see bacteria that are supposed to be in the mouth, or that we see in everybody's mouth. I mean, we definitely need a healthy biome. So we need some good bacteria. So we're going to see some on that report. We're going to see this bacteria is normally found in an oral bacterial population. But then on the other side, we see a lot of these, like what you're talking about, these anaerobic bacteria. Those are the ones that we're the most concerned about, because they're the ones that release these toxins. And the toxins are what are so potent as far as harming the immune system, or being this low-level chronic irritation to the immune system. And so, yes, those bacteria definitely can leak out. And we're talking about things like, oh gosh, I wish I had a list in front of me, but things like in the Clostridia family, things in the staph family. Definitely, they have added an additional test where you can test for Lyme. I've had patients that we definitely have seen some Lyme bacteria in a cavitation sample, but I always tell patients, you can have a Lyme diagnosis and the Lyme may not show up in your cavitation, but what we're concerned with is that the bacteria that are there are compromising your body's ability to fight the Lyme. So you can run a Lyme panel on a sample from a cavitation or a root canal. It just doesn't, I tell patients not to depend on that for a diagnosis, but our whole thinking is just in how that's affecting your immune system from that side. And then as far as in being released into your bloodstream, yes, that is being released into your bloodstream constantly. That's how those toxins are reaching. So everybody, I have patients that get a little unclear on if we're saying that the blood flow is compromised and that's why these bacteria populations flourish in a root canal or a cavitation. It's not that there's no blood supply, it's that it doesn't have that robust flow like it does in the healthy parts of our body. The blood is used in so many ways as far as a filtering system and to bring nutrients and take away waste and to fight infection. And if you have a real slow, stagnant blood flow, it can't really do that. But those toxins could get dumped into your bloodstream very easily. Now, one thing that, and you can find this on our website, there's some links to some research, but some new research recently has come out. And interestingly enough, some of it was actually published in the Journal of Endodontics, which is the journal of the root canal specialist. And it is stating that there are some definite, they really feel like, I shouldn't say definite, I take that word back. There are some correlations between the bacteria that are in an infection at the end of a dead tooth, which would be called an abscess. So that's when if a dentist shows you, hey, you have an abscess, you have this big black bubble around the end of your root. That means the infection from the tooth is now destroying the bone around there. And the bacteria that are there are definitely showing up in the heart. And also people that have those infections have a higher risk of having heart issues. So they're really making that connection with heart and coronary artery disease, risk of heart attack, risk of stroke. Those kind of things are increasing with people that have these infections. We've already known for a long time that the bacteria from periodontal disease can show up in the heart. That's been well documented. But now they're showing that actual infections in root canal treated teeth or other dead teeth make people that have those have a higher risk, seem to be at a higher risk of developing these heart issues or exacerbating an existing one.
That is incredible. Because you think, being just brought up, I guess, in mainstream life, hey, go brush your teeth twice a day and, floss. And so it's a little bit more in depth than just brushing twice a day and flossing your teeth before you go to bed.
Yeah.
You really want to take care of your teeth. I always tell my children, hey, look, you only get one set, after your baby teeth are gone. So you want to take care of them for as long as you can and learn from your parents here. We're trying to dig and research as much as we can. I think I live on PubMed now. Like, that's my favorite hangout. And I even came across a study there that it was saying that 88% of people who have had an extracted tooth has a possibility of having a cavitation. And when I read that, my friend from Illinois, he actually flew down to y'all's office,
Mm-hmm.
and Dr. Nunnally did his procedure. And I think this was 2 or 3 months ago.
Mm-hmm.
2 years ago, he had 4 wisdom teeth removed and a root canal put in. And he's a really smart guy. He's a farmer, and he conducts a lot of business up there in Illinois in the Midwest. And he was like, ever since this procedure, Chris, I just have not been able to think clearly. You could hear him trying to fumble on his words. Like, he'd always lose train of thought just in mid-sentence, and just boom, it would leave him. And I'd always have to remind him what he was talking about. And he always attributed he thought it was the anesthesia that he went under. He's like, I swear it was that gas they put me under. I told them I didn't want to, and they could have just done some local anesthetics and I would have been fine. I could have toughed it out, but they insisted to put me under. So I just said, okay, you're the doctor. You know what you're doing. And after I had read that book, Paleocardiologist, and done some research online, and really where we found you was the Root Cause documentary that was out there. And my wife fell in love with you, and she's like, we got to go there. I was like, hey, we'll do our best we can to get down there. And I told him, I was just so confident on what I'd read. I was like, look, I guarantee you, without ever seeing an x-ray, I just told him to go get a cone beam. And I said, you need to have that cone beam. This is another thing, because many people have the cone beam x-ray. They say, oh, I've got that. But their dentist doesn't have the proper software to interpret that type of x-ray to actually give them the analysis of what's going on in their mouth. They just say, okay, look, on a normal 2D plane, it's like everything's normal. We don't see nothing. And sure enough, he made the trip and flew down to y'all's office, and he called me the very next day while in recovery, and he said, Chris, I feel like I have my life back. And it still gives me chills every time I say that, because I'm just like, oh my goodness. And he told me, he said, if I would have known I would have got my life back like the way I feel now, I would have sacrificed an entire year's income to have this, to not have to go through these last 2 years of struggle. And I was just like, oh my goodness. I mean, that speaks volumes.
Oh, that is, I love to hear that. And that gives me chills anytime I talk to a patient. So I'm right there with you, but especially when you watch somebody, have a turnaround like that. And, that's our prayer for every patient we treat, would just be that we would be removing a source of infection or a source of toxicity that is causing their immune system to react or contributing to their immune system reacting in a poor way. And we do hear so many stories like that. We never want a patient to think that we're going to say, hey, if we take this root canal out, or if we take all your mercury fillings out, everything heals, because that's not the case. A lot of times, like you said, it's a lot of factors all together that have added up. But if we can remove the burden that's from the mouth, we're taking a huge toxic burden off. And so, like with your friend, that root canal and that infection, he probably had been dealing with those cavitations and the toxicity associated with that just fine. His body had been processing that just fine. And then if you add in the root canal or maybe another stressor in his life, and it just kind of all of a sudden made his immune system react differently. So that's a good way to think about that, is once again, going back to what you said about just adding up these things, then all of a sudden something you didn't respond to before now becomes a bigger problem.
Right. And I know when you said, when my wife is in that chair, you said, hey, can I pray for y'all? I was like, we found a winner right here. Because I don't know any other doctor or dentist or anybody that has asked to pray over us and with us before a procedure. And so that really hit home with us. That was really awesome.
Well,
And
I'll tell you, I feel like everything we know is just scratching the surface about the way that the Lord made our bodies. And I feel like He's allowed us to have this knowledge. We want Him to bless everything we do, because we're really just His hands and His feet. And so it's a privilege when we get to pray with anybody. We pray over all of our patients if they'll let us. I have yet to have a patient tell me no. But I know some of them find that a little different. It's very different. So I love it though when we have a kindred spirit, and I know we're both praying in the same way. I know the Lord's Spirit is there with us. So I appreciate that.
yeah, that's awesome. And talking about the Bible, kind of, I was looking at Facebook, and to me, Facebook is kind of like eating from the tree of knowledge of good and evil. You really don't know what you're going to get on there. And I had seen something that people are actually training. The ADA is sending out information to people who have actually seen the root cause, so that when people question root canals, the dentists have like a canned response on how to I guess kind of fire back at their patients by saying, no, that move. Dr. Freeman, you there?
There we are.
I had some internet connectivity issues on my computer, so I just went through my phone.
Oh, okay. All right.
So I'm gonna set up my tripod, just stick my phone in here so I don't have to hold it the whole time.
Okay.
Uh,
Well,
yeah.
I'm glad it was you and not me, because usually it would be me. I would have hit a button or something.
I didn't know what happened. Maybe they heard us, the FDA or something heard us talking about them, and they're like, let's cut this off, this nonsense.
Oh, well.
Big brother. There we go.
Okay.
But yeah, have you heard anything about that as far as the FDA or?
Well, I haven't heard anything with the FDA.
Or I'm sorry, the ADA.
No, that's okay. You never know. So yeah, so I'll just back up just a little bit. So about 2 years ago, we were asked to film some interviews for this root cause, and we were told it was someone out of Australia, and it was another patient of ours and someone that refers a lot of patients to us. And he just asked us kind of as a favor. He said, I think this will be a big deal, but it's in Australia. It may just be a local thing. We were happy to help out and did the video, or they came to the office and interviewed Dr. Nunley and Dr. Owens and myself. And we didn't think a whole lot of it after the fact. And about a year went by and they sent us a little clip of it. We were like, well, that's interesting. But okay, we'll see what happens with it. And so then come January, we were all, give our staff a good break at Christmas, and we were about to come back right after New Year's. And we got a call or an email from a patient that said, hey, y'all are on Netflix. And we were like, what? And so it really took us by surprise. And so we watched it kind of along with everybody else on Netflix, and got to see the whole thing put together. And we're just very impressed with his lineup and the way he put that together. But we really did not expect the response that we got. And so many patients that really, the video really resonated with them. They felt like it was their story. And I think he did such a good job of letting people relate to him as he told that story. And there's so many people out there that feel like they haven't been heard, that they've looked in so many places for answers and haven't found them. And so while it may not be everyone's answer, I really think it let people out there know that if they keep researching and they keep looking, that they can find someone who will listen to them, and that their answer might not be where the pain is. It may be related to something in the mouth, and we're definitely going to help them look for it. And so then, of course, there was, as it got more popular on Netflix, we started hearing, of course, some rumblings, and we knew we were probably making some people unhappy. And our goal is never to make enemies or to accuse anyone of doing anything intentionally wrong, but possibly of not being aware of or not looking at the research that's there. And so, yes, a few months later, we had another patient email and say, hey, you might want to check your email inbox from your ADA president, the American Dental Association president. And it was a very strongly worded letter that I think he probably has come to regret some of, but it basically, and I'm a member of the American Dental Association, as is Dr. Nunley and Dr. Owens and Dr. Dorsey. But it said, there's this terrible movie out there called Root Cause, and it's total lies. And I think he says, we know root canals are safe because however many million are going to be done this year in the United States. And we were like,